What are some of the safety and protocol techniques that you use?
To get optimal results, patient selection is very important. Do they want smooth and twist threads? Do they need that in the beginning to build collagen? Then we'll go to a barb thread later to actually lift skin and pull. What does that patient need? What is that patient selection looking like? We, of course, as injectors, injecting in the proper depth, injecting so that we're not pulling skin too much to give a side effect that was going to last for 2, 3 months. We don't want that. We want all the threads to lay in the skin nice and smooth, give that lifting effect. For the most part, when it comes to safety, is making sure that the patient's comfortable, making sure that you're using lidocaine. I use lidocaine with epinephrine so that it blanches the blood vessels so that I can go in and do what I need to do safe, and not placing the threads too deep. Because if you're placing the threads too deep, you're going to irritate the nervous system. So we don't want to actually have any sort of motor nerve system, or we don't want the threads to sit too superficial to have any sensory feeling. All of this is important when you're learning technique. We definitely focus on avoiding the nervous system and not placing too deep into the nerves or around vessels.
I know that you are one of the sought out trainers for Les Cray. Is this something that you spend time teaching?
Aside from me injecting and loving how to inject these, it gives me a different modality in my practice. It really offers a great outcome and happy patient, happy results. And it's fun for a practitioner to do. And when I'm training and on the educational platform, everybody can see the passion that I have for threads. Threads are just exciting. They're like, let's paint a picture and let's do it this way. The practitioner has their ability to paint that picture however they want that day. We focus on all the hands-on and give you at least 3 to 4 patients to actually get your hands on to actually do the putting in the threads, putting them in the different fashion. There is protocols for this. It's not that I always know when somebody has watched YouTube and that's been their intro to threads, because they just stick threads any old way and they're just sticking them everywhere and they're half stuck out of the skin and they're not even in the skin. And there's issues with that. So we don't need to use thousands to get the results, although Les Craze as a company would like that probably. But there is only so many threads that you can put in the skin before you end up starting to have problems. So there is a art in this, and there is protocols in order to get results. We have a lot of white papers. Most of them was recent within the last a year or so that actually prove that putting threads in a certain fashion actually produces more collagen building. So we're starting to get more studies out there that actually are available through Les Craze to show you that, oh, this is why we do, how we lay it down. This is the process of why we lift in a certain plane, why we're building collagen in this area and laying it down in a certain fashion.
I think one of the things, and you brought up YouTube, our YouTube injectors, which I really got the experience with over the years. Ever since COVID happened, we had this new plethora of people on social media and YouTube videos that explain what you should and should not do. And these are yes and no's and inject this way. I even see Botox, inject all these other special ways. And I'm like, oh no. I have a lot of videos from people, but this is the era of these really easy procedures they contemplate as easy. But in the thread world, they view it very something like, I don't want to touch is super taboo. We have a lot of people that are influencers that say, just stay away from threads. They're the worst things on the planet. They're so scary and they don't work. What is your take on that?
One of my hardest things to do is both the patient and the educational platform is to, on the patient end, patients do come in. And when I recommend in a consult, they're getting younger and younger, but they come in and they want natural results. They want a natural product. They don't want to go to fillers yet. So threads are up for conversation, right? I do exosomes. I do it all, but I've got to put all these modalities in that's going to be appropriate for that patient.
Yeah.
So for the patient that wants natural results, talking to them about threads, I'll say threads is a great avenue for you to go. Right away, they're going to go, oh, not threads. Oh God, I seen that and it's so scary. And I'm like,
Yeah.
okay, what's scary for you? Right. So I'm answering their questions as they're coming at me. Oh, those things I heard they stick out of the skin and they cause problems. I heard that they have lumps and bumps. So whatever that is, I say, listen, whether it's Botox or fillers, anything on the market,
Yeah.
you are going to see some side effects because people try to learn it too quickly and they don't learn it in depth and they just go out and do it. That is where the problems lie. Do we have problems? Can we battle those problems? Yes. If you have a lump and a bump, we're going to just create a little star over the lump and a bump with a smooth thread, and we're going to push it down because it's trying to poke out of the skin. So there's ways of battling a lot of it, but there is a lot of myths out there, negativity of, oh no, threads. I don't know why it's out there with negativity. Maybe it's there with everything. But because I do so many threads, I get a lot of consults and a lot of the consults are coming in for, oh, I don't like superficial lines. I don't want to go to filler yet. What are my options? I lay it out there and I tell people all the time, you can laser. We can combine the threads with any of these modalities. So I may laser somebody first.
Mm.
And 3 weeks later, I'll put in threads right underneath the lasering. I may wait 4 months. And if they're still not happy, I may put a little HA, artificial HA, a little light filler over it. So while we're waiting for the collagen building to happen, we may put all these modalities together to make it work. And again, all of them are safe modalities. It's just the matter of trying to make that patient happy at whatever point they are in the journey. And that journey may change. That's why we have to change as injectors. Threads, I speak about threads and I say the word threads probably at least 50 times a day because all the consults are like, oh, she's going to talk about threads. My MAs probably hate it because I talk about threads a lot. Where some dermal fillers like underneath the eyes is not for everybody. That's an area that can be a hot mess sometimes. And I see a lot of hot mess on the streets. And some people just are not candidates for dermal fillers. The skin is too thin. I put under eye threads in there. That is my hottest treatment. And that is where it's like a multi-level marketing. You change one person's under eye threads, they're going to tell 5 people about it. Those 5 people are going to come to you. They're all coming to me for under eye threads. That's the number one treatment. That is my favorite treatment. And to change that lower lid, even before surgery, if somebody wants it, they're improving that skin. Their surgery outcome is going to become better in the end.
I think the contributing factor to all these people being afraid of this treatment and all these bad results, I believe it's actually coming from those YouTube learning clients or practitioners that just learned on YouTube and they just want to do something and then they make a terrible mistake. And a lot of people too, when they're getting into it is an art, it is a practice like Botox, like filler. You can make a mistake, but that doesn't mean all of a sudden Botox is terrible and it doesn't work. We all have to adjust and learn a different technique or way. Everybody's different, so our anatomy is different. I think we can make a mistake and try to learn how to do better. For the ones that do learn on YouTube where they think that they could just bypass training altogether, and then they give the bad name. If you were a patient looking for threads, what would you look for?